Hello, everybody. My name is Stacy Nell. I am the Executive Director of the Kansas African American Affairs Commission. Shalese, how are we doing?
We're good. We're
Yay!
good. Good. Third time's a charm.
Y'all, y'all, the amount of technical shenanigans we have just been through, but it is working. StreamYard has come through. So, hello, everyone. Welcome to our Lunch and Learn. I'm here with Shalese Clay, and Shalese Clay is the CEO of 38 Solutions, an organization that we will talk more in depth about. So now, Shalese, hello, how are you?
I'm good. I'm happy to be here and be able to be seen with you now.
Yes, there we go. And I already asked this question, but you got to tell us, what did you have for lunch?
So I had a piece of a lemon loaf from Starbucks. So we're in the process of figuring out what the tummy really wants.
Yeah, I hear you. I had breakfast, because that's the thing, we're recording, and it's not even lunchtime yet, so I haven't even really thought ahead yet to know what I'm going to eat.
Right.
Yes. So hello. I need to back up and let people know who you are and let people know what you do. So Shalese Clay is an advocate for maternal and infant health issues, and her sole focus for the past 9 years has been on advancing health of women of color. Okay. Shalese works to engage families, making space for families to share experiences with decision makers, and working with health leads to educate parents on the importance of reproductive health and safe sleep. Shalese is also the founder of Dope Black Dads, KCK, and the executive director of Queens Village Metro of KC, and the CEO of 38 Solutions and founder of Elevating My Community Incorporated. Raised in Missouri, Shalese also works as a community health worker with a passion for maternal and health issues, in particular, advocating for the health of women in color. She's also the chair of the board of directors for Uzazi Village in Kansas City, Missouri. So, hello.
Hi.
I
That's a
know
lot.
it's a lot, but you know what? That's why it's a lot, but that's why I had you on this program, because I know you've
Thank
been
you.
doing a lot of work in an area that's near and dear to my heart, which is dealing with, like I said, health outcomes for Black maternal and infant health. So, tell us a little bit about you, like your
Okay.
background, how you landed in this work.
So really, I don't even call it luck. I was a Head Start mom, was a single mom at the time, and through my Head Start journey, I was given opportunities to do different things, and I took a lot of classes and a lot of lead roles and sat as chairs and all the things. And so they offered a community health worker course at the time. I was still running the medical department for a group home. So I was doing that using my CNA and then doing the schooling at the time. And so I really was just trying to get out of that job field of pharmacy and medical and actually got a job working at Samuel Rogers for Healthy Start. And that's where my maternal health journey began. Not even realize that I had been a victim of medical trauma as well with my maternal health story. And so it really just came from all of that.
Wow. So your background is actually working in pharmacy with your
So
CNA. You said.
I have had CNA and pharmacy experience, yes, and ran the medical department for this group home for several years. And then as they bought out, I went and worked for the pharmacy. And so this kind of went hand in hand in doing the work.
Gotcha. So see, it's funny. All the things that I know about you, I did not know that. that your background is actually in nursing. That's crazy. That's
Yeah, well,
crazy.
my mom was a cancer patient, and when I was younger, and I was her only child, and I learned a lot, saw a lot, and was like, I'm going to do that. I actually wanted to go into nursing at the time, and I'm happier with this route. I think that being an advocate and on this side of the line is much easier for me.
Gotcha. Okay. So I did want to talk about the community. You said you were Health Start mom and you saw community health workers
Yes.
and thought, okay, what is this? Now, so community health workers is a thing that I've had on this Lunch and Learn at several occasions. Like I had Uzazi Village. I've had people from Uzazi. I've had people from health departments. I've had people who are doulas talking about community health workers. But just again,
Yes.
tell us what a community health worker is, how you got involved with it, and if people are interested, what they should do.
Absolutely. So I was in the second class in the state of Missouri that offered the community health worker class through MCC. And so really it's the bridge between community and the system. We are here to help guide families, help them find resources, really help them navigate how to have conversations and be a better advocate for themselves. Honestly, I think the role has kind of changed over the years. I got into my community health worker class in 2015. And so I can see how now it's more check of the box, just to be honest. But the goal is still the same, is to reach out to these families and really help them get in the healthcare the equitable care that they really deserve by helping them navigate the system that is not built for them. And
Right.
so there are classes. I know Community Health Council of Wyandotte is a place that offers the community health worker course. And if you get certified there, you get certified for both sides of the state line. It really has involved, honestly, Stacey, since I was a community health worker. I mean, now we have all these certifications, and it's just it's more structured than when I came in.
Gotcha. So if you had to, this wasn't on the agenda, if you had to take a guess, ballpark it, how many community health workers are working in the metro area?
Oh
We're
my
talking
gosh, there are
hundreds or
hundreds.
thousands.
I mean, actually, there are so many. Now, providers are hiring on, clinics, of course, are hiring on, but I'm also seeing insurance companies get involved with hiring on community health workers. So they are really expanding the role. And technically, community health workers have been around for so long. And I know I'm not going to even say the Spanish word for it correctly, but Pomodores, something around there. I'm not going to try to fix it. But we have been doing community health work for a long time. It just didn't have an actual name. And so, like, even a navigator is somebody who they consider a community health worker. It just depends on the organization you work for and how they title it.
Right, right. So now, in your opinion, and again, I
Mm-hmm.
know what I would say, but I'm not a community health worker. What is the benefit, right? Why is this such an important role to have in a community?
Yeah, well, I think people just don't know what they don't know. And for me, that's why this work for me has continued so long. Because a lot of times we assume that people know how to navigate the system or people know how to get on the phone with Medicaid and Medicare and access those benefits or even know what their benefits even cover, let alone how to navigate getting into special doctor's appointments or how to get transportation. So this way you can have somebody help navigate that for you and just teach you how to also navigate it because it's really about teaching people how to maneuver the system, not just walking them hand in hand, but also giving them the tools to be able to get the services that they need themselves.
So how would a person, now obviously if someone's watching this program, they're like, oh, community health
Mhm.
workers. But if a person, how does a person access a community health worker as a service if there's a person who needs that?
Well, I would check with their local clinics or wherever they're getting care from to see if they even have community health workers. That's the start. If they
Mhm.
don't, they can reach out to organizations like KC Care has community health workers. Most FQACs that I know in Missouri have them. I know Community Health Council of Wyandotte has them, and they also do referrals. So even if they're not seen at a clinic, if they go through a referral program, they can be connected to a community health worker, and then they will follow up with them from there.
It's funny because as you're saying this, I'm like, well, I think maybe I did access community health workers with the birth of my first child because she was not, we had speech services and it was a
Oh,
person who came to our house. I'm like,
yeah.
I'm like,
I mean,
that's
it's so helpful. I mean, people really just don't know all of the benefits that having a community health worker because a lot of times, again, some places don't have access to community health workers. But once you get one, you're like, oh, I can tell the difference in care. I can just tell the difference of things I've learned that help me be able to get into this appointment or just how to have a conversation with my provider or even my nurse. I think a lot of times we're seeing people needing help with transportation, housing, food. Community health workers connect the dots to everything. It's not just medical based, but it is also community based.
wow, that's great. That's great. Okay. So how long have you been working in the field?
So 9 years when I actually started my maternal health background, and so it's been 9 years now.
All right. And then how did you get to that focus of, like you said, you were working on in the pharmacy CNA
Yeah.
space. So how did you make the shift to maternal health?
Honestly, I was like, I need a new job. I was ready to leave, and my mentor at Head Start put this job in the chat, and I don't even know if any of my other classmates applied for it. I was just like, I'm applying, and it was with Healthy Start, and it just came to be the job that my last day of my job, I got the call back that I got the job. And so it was like meant to be. And so I have just been in maternal health work ever since then.
Wow. Okay. So in working in that space in particular, what have been some of your experiences?
Yeah.
What have been some of the, because it's one thing to say I'm a community health worker working in maternal health. That's fine. But
Hmm.
what did you see that prompted you to say, okay, no, I need to do more, like, and get involved more heavily with the Kansas Birth Equity Network. I've had Charlotte on a couple times to talk about the work there. Or then to move on even further, I know you've applied for mini grants or to work with Dope Black Dads. So how do you get from one to say nothing? I mean, to put no, it's a big thing to be a community health worker.
Mm-hmm.
How did you move from that to say, okay, I'm going to go to this next thing?
So it was really sitting and hearing Hakima, who is one of the founders of Uzazi Village, talk about some maternal health issues and traumas that people face. And I was sitting in the audience like, hold on, that's me. Then just reflecting on a lot of my clients and at Samuel Rogers, which is a great experience for community health workers to work at, truly, because they have 38 different languages. I had 10 on my caseload. So you get to learn how to check your biases. You get to learn about all the resources, how communities navigate. And so I was seeing it was a common thread with families of color who are having these same issues, and just like how to be respected when you're going to your doctor's appointments, or just how to feel comfortable even expressing what's really going on with your body. It was all about not being seen or being heard. And so I started to take much more of a lead approach. And then I kind of got pushed into some lead roles. And so because I'm the social butterfly typically in the group, I was always the one who was speaking in the room. And so I was able to navigate the system that way and find out like, okay, well, who are the people at the table? And then Mariah came to me and was like, hey, she wanted to start Cradle KC. And if I came and worked with her, what would that look like? And mind you, I just finished my hard-earned associates not that long ago, but I have been pushed into positions which gave me opportunities to sit at the table with people who did not look like me. Mm-hmm. And so from that, I was like, okay, I'm asking people in the office, like, well, what does this person make? And I'm writing down everything I think that I could bring to Cradle KC. And we just partnered up from there, and it just took off. So we did the reproductive life plan book. So from Head Start working at Cradle KC, became a program manager, and we've managed several different programs, but one near and dear to my heart, which a good friend of ours, Broderick Crawford, started, was Every Baby to One. And so that is a faith-based initiative that really focuses on infant health, so safe sleep, social support, and safe space. And so we wanted to go into the churches, especially the Black churches specifically, to help them understand that these things are happening. And yes, you can pray about things, but we really need to do something about it. Because in that church alone, I want to say they had maybe 20 infant-related deaths in his particular church. And that's how Every Baby to One started.
Oh no.
Yeah. I mean, it's all shocking, but it happens all the time, and we don't talk about it. And I think for me, that's when I also realized, like, okay, if we're not talking about it at church and we're not talking about it at home, where are we talking about these things? Because I can get on my soapbox and advocate for my families, but I need them to have the education to come out here and advocate for themselves, because I'm only one person. But really, that's the snowball effect for everything that I have done and continue to do, is wanting to make sure that my community is educated, making sure that they have the tools and are equipped to sit at the table, and then to also help them push for action.
So let's talk about it. Every Baby to One, because I know KAAAC has another initiative like Day 366, this idea of, so what are, and I should have warned you to have data at your fingertips. I didn't say I would talk about numbers, but we know the statistics for Black maternal and infant health outcomes are not good.
Yes.
So, and if you're saying that Broderick Crawford's church alone, they could count 20 infants, infant mortality. That's just it makes me sad. Yeah. So what is the situation out there for Black families, I should say?
I think it's still the same. Unfortunately, we know that we are preaching to the choir, but people still don't believe this is happening. And then I think about, for me, first-time Black families, it's always scary when they don't really know. I'm not gonna lie, even now, I have a sister cousin who is about to have a baby. It's terrifying for me because I know the rates of her life ending before she even gives birth, and then even after. And so, we want to make sure that the systems are in place for us, but I am to a point, honestly, Stacey, where I'm like, let's just build our own ecosystem. It might be easier because we can make sure that we can rally around these families. We can give them the education, really push for doulas and midwives so people can have that extra support if they want to have a traditional birth, or even talk about home birth. I think we have gone away from that, gone into having traditional non-traditional births, that it takes away from the safety that you might actually have if you just give it a try. But and that's not everybody's circumstance, because we know high risk families are not able to do home births, but it's just the nature of the system is designed to do exactly what's supposed to do.
Yeah, and I think that's the uncomfortable truth when you talk about home births or doulas or midwives, is the uncomfortable truth, because I've had two children here in the state of Kansas, and I was older when I had them. I was 36 and 38, so I was advanced maternal age,
Listen,
right?
my mom had me at 42, so you're young still.
There you go. But that the statistics, and I knew some of the statistics, nowhere close to what I knew now, because this was again
Mhm.
15 years ago. That the odds were not in my favor going
Right.
into a hospital to have a child.
Yeah. And it's
So
even with your education, we know it doesn't matter your economic background, it is still your rates are dying is still higher than our white counterparts.
that's
That
crazy.
yeah.
And I did, and I've said this before publicly, that I think some people don't think that Black families actually have these conversations, but I had this conversation with my husband. Like, okay,
Well,
if like, you follow the baby, like,
mhm.
I'm gonna die, just you follow the baby. It'll be me and God. We'll figure it out.
Yeah. I mean, but we just did our first Dope Black Dads baby shower fatherly celebration. I'm gonna change that. But one of our speakers, Lewis Spence, talked about his experience with him and his wife, and they had three stillbirths.
Wow.
And it's like for men to experience that, and knowing that their wives or partner have experienced that, it's just like, and these are people who visually you'd be like, oh, they're good. But I don't even think they were really having the conversation initially, because we have normalized these things to happen.
Right.
We normalize gun violence. We normalize
Mhm.
diabetes. All the things that are affecting us the most, we just get accustomed to, like, okay, well, because even my story, I said, oh, I thought what I went through was normal. And then find
Right.
out, no, I went through a traumatic experience, and I could have died, and so could my child.
Right. And even if it was normal, it shouldn't be. And and I'll use this since I want to make that transition to talk about dope Black dads.
Mhm.
A lot of this conversation has been, and even I always talk about it, about Black maternal health outcomes, or Black
Mhm.
maternal infant health outcomes. But one of the things I appreciated most about why, and I wanted to get you on to talk about dope Black dads, or even some of the work that Charlotte's done with KBIN, is really this idea that we're talking about the family, and specifically to allow for a very pointed focus on the fathers. So
Yeah.
yes, how did you make the leap from, and like you said, it's not much of a leap. It's not a far leap from working with maternal and infant outcomes to say, okay, hang on, there's another person involved.
Yes. So actually, I was at a breastfeeding conference in New Orleans, and it was with Reaching Our Sisters Everywhere. And I kept seeing a lot of black men with these shirts on, supporting black women and breastfeeding. And I was like, oh, that's really cool. The very last day was the most impactful day for me, because I was able to hear black men speak about maternal health, also speak about their roles in maternal health, but also seeing that we had older gentlemen who were IBCLCs, who were in training to be doulas, who were doing all of this maternal work. And I'm like, hold on, these are really active men. And mind you, I did not grow up in a two-person household, but my uncle, my mom's youngest brother, raised all of his kids and his wife's son, and he was like a dad to me. So I've seen what male presence can do and how it can benefit you. And so I was like, we have to do something like that here. And really, I just came back, and I was working with Brenda Bandy at Kansas Breastfeeding Coalition. And I was like, we have to do something. I don't know what it's going to look like. And so started working with some of the guys in Kansas, and it came to fruition. And so we're in year two. We're going to be doing some changes, but it's really, like Charlotte said the other day, this is a movement. And I'm really inspired to see dads want to be so involved, and not that they weren't in the first place, but
Right.
to actually see them stepping in and saying, no, we are here, we do want to speak up, we do have a voice. And also working in this field, to be completely honest, I work for a hospital on the Missouri side for March of Dimes, and I have been in the room and heard conversations that were not pleasant about families of color and how they discriminate against black dads specifically, and as far as even drug testing them for no reason, or just having that suspicion that they may be doing something illegal. And it interferes with them seeing their child in the NICU. And that just really bothered me. And so I wanted to make sure that I was able to create a safe space for them but also giving them the information about maternal health. And then in our first meeting, we realized that we needed to have a focus on mental health, because guess what? That goes hand in hand with dad supporting mom, or the partner supporting the birthing body, because a lot of times we don't think that they're experiencing anything, but they can go through baby blues just as much as mom can.
Yeah, it's got to be stressful for them too.
Yeah.
And I think one of the things I love about there is this through line, talking with all the people I've talked to about maternal health, is the one to recognize that fathers are experiencing this at the same time, and then just in general in society, to destigmatize the issues of mental health, and in particular in the Black community, to help to continue to destigmatize. I think there's definitely movements towards talking about mental health in the broader community. Even have you seen Inside Out 2, that new cartoon?
Oh no, I'm ready to go see it though.
It's good. I won't spoil anything, but just even making a kids cartoon talking about mental health issues to help destigmatize it. So when you find in your work with Dope Black Dads to help to continue to support and destigmatize what men may be going through, right? Like if I'm talking to my husband saying, if I die, like that's got to put something on him.
Right. True. And if like we did Aftershock 2 years ago in Wyandotte, and we did a viewing of Aftershock, which is on Hulu, with community partners, and we had a panel. And then we also had one with the stakeholders and the doctors and nurses and community health workers to show what it looks like when a Black family is destroyed by a maternal death. I mean, not maternal death, but with a mom dying from, childbirth. And so it was really interesting to see the dynamic of these men who are raising these babies alone. And it was really inspiring to see and show people what's really happening.
Yeah. I Godspeed. Everyone working in the maternal health field is I think doing fantastic work. I don't know why it is in America, because worldwide, again, these are stats I remember from when I was pregnant. Worldwide, women die in childbirth all the time. And in America, even for white people, like it's ridiculous how many women die in childbirth. And then put it on top, it's ridiculous how many Black women die in childbirth. It's beyond me. I don't understand why, just in America, why women are dying in childbirth at the rates that we are. It's
well, and they're preventable. A lot of them are preventable deaths.
Yeah.
That's the sad part.
Talk about that. What are some of the things that people can do? Like, let's say maybe someone who's watching this right now, or someone who's person, their aunt or uncle, someone they know is having a baby, but they're like, holy mackerel, this is preventable. What are some of the things that are obvious to you, but may not be obvious?
So for me, I think that if you don't feel comfortable, number one, with your provider, you can fire your provider. You can go somewhere else. You have the option to say, no, I'm not feeling okay. This is not okay. Go to another hospital. If you feel like anything is wrong, the first sign, speak up and go take care of it, even if you have to go to another doctor's office or if you have to go to another hospital. Also, when it comes to anything blood pressure related, I love K-Ben. Dr. Charlotte Smith has been doing amazing work. When I say I have been in this field and only seen the needle move a little bit with a lot of organizations, she is one that has pushed forward that needle, especially educating the residents about maternal health and the importance of looking at Black families like they are all families. But really talking about preeclampsia, which a lot of us experience, and not knowing that there are some things that you can do, some preventable measures that can happen early on. And just like talking about food and making sure that you're not just out eating a bunch of stuff that is not healthy for you. I know access is a huge issue.
Yeah.
Did a project with Rebecca Leaping, and we went to a lot of the grocery stores in Wyandotte County specifically and tried to navigate what that looked like for WIC. What does that look like to get access to get there? And it wasn't that they were in a food desert, it was access and having good food for you to go get. And so if we have conversations ahead of time, pre-planning, do you even want to have a baby? Let's start there, because a lot of times we're not even talking about it. A lot of us are just like, oh, I'm pregnant. And then, how do you navigate that? But families have to be willing to first have the conversations with their kids or young adults and say, hey, these are the things you can do to prevent. And if you don't want a kid, this is what you might need to do. Secondly, having a provider that gives you care, that makes you feel safe. That way you can have the conversations about, I don't feel like this is happening right, like something's not right. And you know that they're going to listen to you and value, because a lot of times we are just unseen and unheard. We are another number for that 15-minute appointment, and I'll
Right.
see you in a few weeks.
Right.
And then if something is wrong, making sure you're staying on top of it. But my biggest recommendation for families is look into getting a doula. Look at getting a midwife. If you're on the Missouri side or Kansas, Uzazi Village has doulas on both sides, and there is funding right now for those high fetal infant mortality zip codes where you can get a free doula and through the city. And so it's really amazing to see the push for doula services right now, because we know we are trying to fight these families from having a loss.
Right. And so if you're not in Wyandotte County, if you go back through the lunch and learns, we've had Breon from Topeka, doula. We've
Yes.
had Sapphire on from the Wichita Birth Justice, and we've had Mama Hakeem on from Uzazi. So I feel like I've talked to, and if you go back through the list of lunch and learns, you can find some doula services in various places around Kansas.
And there are some dad doulas, because right now dads need the support. So everything that I design is also inclusive for fathers, even if it's breastfeeding information, so dads can support, or doulos who really work to help support dad in navigating, because everybody has to learn somewhere. A lot of us didn't have good representation, and so having that peer-to-peer is amazing. I think that is one of the things I love about community health workers, but now we're using that in the design of working with dads.
Right. I'm gonna have to look up that doulos. I had this. This is good.
Yeah.
I'm learning. I'm like, this is good. I hadn't heard about that as a thing. Okay, so now I do want to talk about 38 Solution. What is 38 Solution? So talk about what.
So yeah, so 38 Solution is my consulting business. The nonprofit was not even on my horizon, which is elevating my community. I was transitioning from my job, and I said I'm gonna focus more on my consulting, doing community engagement work, which also is a part of the DEI portion I wanted to get into for corporate. I see how DEI is not utilized the way it should, and they push it on lower level employees, but they don't want to start from the top. And so I was trying to redesign a tool for training for corporate America and even FQACs. And then a conversation took place, and it was like, okay, if you want to take this program with you, you're going to have a nonprofit. So besides 38 Solutions doing the consulting and community engagement piece, I have now this nonprofit that houses Queens Village, which is a maternal national program that I run here. And then I was like, well, I already have Dope Black Dads, so I guess we're just going to push that under there too. And it's just a lot of things happening at once.
Well, you know what? It must be meant to happen.
Yeah, I mean, I'm very, very thankful. The people who have been a part of all of the growth in these programs have been very influential. I think that we are all on the same page. It's like we want to make sure our community has a place that is for us. So when people technically ask me what I do, I say I create Black spaces. Everything that I do, from my Black Girl Happy Hour to just White Co-Milk and Breastfeeding Coalition, I am is specifically making sure that we have a space that we can talk about things, and they are safe for us to have those private conversations.
Awesome. All right. Well, let's see. So do Dope Black Dads, they still have meetings first Friday?
So actually, we do have a Facebook page. So Stacey, I'm working on getting all of my social media up, because somebody told me they don't like Facebook. So we won't be doing meetings this month, but we will start doing some virtual things and then some in-person things. And so, as I was stating earlier, and Charlotte said this is a movement, it really struck something in me to do something a little bit different. And so some of the guys wants to do lunch and learns and more panels and meetings. So we're going to really focus on that mental health component also this year. And so we will be doing the meetings, but it will look a little different. So if people follow us on Facebook, all of that information in the new calendar will come out, and you can follow us from there.
Dope Black Dads on Facebook.
Yeah.
There we go. All right. Would you believe, that half an hour goes quick.
It does. I'm really excited to share about all this work. It's so many great things that are going to be happening for Dope Black Dads. And I'm just really happy to share this with the Kansas residents, because we really want to make sure that our dads are uplifted. And whatever we can do, we want to make sure we can provide those services for them.
I love it. I love it. All right. Thank you so much. Thank you much to
Thank you.
Shalese Clay for joining us today to continue this conversation. I feel like this is a conversation that I have just been continuing for the last couple of years, having everybody I could think of in the space on to try to push the message out. I think it's just so important that we learn to take care of each other.
Yeah. Well, these lunch and learns are really important, and I really appreciate you even asking me to be a part of it. I went and did my research and saw all the great people who have spoken before me, and I think if this work is not easy, it does not always pay well. I mean, a lot of us are doing it for free, and so
Mhm.
it's really helpful to be able to shed light on the work that we're doing, so other people can know we're out here.
Yes, great. Thank you. All right, everybody. Thanks so much for joining us, and I will see you next time at our next Lunch and Learn. Bye.
Thank you, Stacey. Hi, everybody.